AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, good evening. Welcome to You and Your Doctor, where we teach you how to live a longer and healthier life. I'm Norina Anderson. I am your life and energy coach and also your host for this evening's show. We're being presented by AMP2 TV and proudly sponsored by All County Healthcare, where patients are the heart of their business. We're streaming right now live on 1470 AM and 95.3 FM. And just in case you missed the show tonight, we're going to be airing again on Tuesdays at 11 o'clock AM and 3 o'clock PM. I'd also like to let you know that we are streaming live on All County Healthcare fan page, the Facebook page. So welcome any of our friends from there. And also we're streaming live on AMP2 TV. So welcome to all of our listeners. It's wonderful to have you here. We are always airing Tuesdays from 6 to 7, and we have various doctors that come in and share with us their expertise, their professionalism, and what makes them special, what makes them different, and also bringing in state-of-the-art understanding to our healthcare system and what we're dealing with now. So, without any further ado, welcome everyone. If you have any questions, by the way, please call 888-717-7170. That's All County Healthcare. Ask for Maddie. Any questions that you might have, first of all, for All County Healthcare and or any of our guests that we have on air, Maddie will love to be able to help you with that. So again, welcome and thanks for coming. And we have a very amazing doctor here this evening. We have Dr. Norina.
Yes.
Oh, it kind of rhymes with Lorena.
Yes,
Norina. Dr. Norina Ocampo. She's a pediatrician with Tenant Florida Physician Services, and she's located in Boca Raton. And I would like to say thank you. Thank you for being here with us.
Well, thank you for having me.
Oh, it's our pleasure. It's wonderful to have you here. So tell us a little bit. What got you into this particular healthcare practice?
Well, when I went to medical school, I didn't know what I wanted to do. I thought I would be an internist because I loved our family doctor growing up. And then that wasn't my favorite rotation, and I ended up loving pediatrics, which I was terrified when I first started, but at the end of the rotation, kids are so much fun, and that's where I ended up, and I love what I do.
I can tell. That's wonderful. When did you how long have you been down in Florida?
We moved down to Florida 22 years ago, and I've been in solo practice for the past 19 and a half years. Wow. And it's just been wonderful because I've gotten to know so many of my patients so well over the years. And I've been here long enough and I'm old enough that now I'm taking care of my former patients' children.
Oh my God, is that amazing?
I know.
You not only, take care of those babies, and then 20 years later, you're taking care of their babies on top of it.
Yes.
Oh.
But it's wonderful because I get to see them grow, and then I get to see them have their kids. And it's just been great.
That is excellent. There's nothing better to watch them growing up and becoming, from babies and becoming adults and watching that whole changeover.
Right.
That's very exciting.
Yes, it is. It's great.
That's wonderful. So you came from where? Where did you do your schooling?
I went to NYU undergrad, and then I went to Georgetown Medical School. I did my residency training at Medical University of South Carolina, the Children's Hospital in Charleston, South Carolina. And after that, we moved to Florida. My husband wanted to move here. I really didn't want to, but I ended up loving it here, and it's great. And we've had our kids here, so it's been wonderful.
Oh, that is super. That is super. How many children do you have?
I have two. I
Okay.
have Christina, she's 23. She graduated last year from University of Miami, and my son is 20, and he goes to University of Chicago, and he's a sophomore.
Oh, wonderful. Now, is anybody following in your footsteps?
No. She's an international marketing and business finance major, and she's doing marketing right now. She graduated. And my son is an economics major with a political science minor.
Wow, excellent. Well, that's pretty cool. And I'm from Chicago, so
Great city.
It's a great city.
Great city.
In the summer.
Yes. Not in the winter.
No, I know. So tell us a little bit about your the clienteles that you work with.
Well, I'm a general pediatrician, so I see all children from birth until they're 21 years old.
Wow.
The day they turn 22, I can't see them anymore. It's a malpractice issue also, but I see my patients through till the graduation from college. When I finished my residency, I actually had the opportunity to work for a year at College of Charleston Student Health Service while waiting for my husband to finish his residency. So I got very comfortable taking care of the college age group, and I've continued to do that. So, and pediatricians can see either through 18 or 21. It's their choice, but I enjoy actually seeing the college age kids, and then it's really sad when they have to leave and go somewhere else.
I was going to say, it's almost like your babies are leaving the nest then, huh?
Yes, it's really sad. They keep growing. I don't know why they do that. They shouldn't do that.
But I would imagine then you still have good communication then with their parents as well, and their parents must be, what, in their 40s or 50s?
Yeah, parents, 40s, 50s, older, grandparents. I've just gotten to know entire families. I have a family in my practice. It's the great-grandmother, the mother, the great-grandmother, the grandmother, the mother who used to be my patient, and now her daughter. So 4 generations of women.
Oh my gosh.
And it's actually so cool when all 4 of them come to the office and you just see all 4.
Oh my
it's really
goodness.
nice.
That's very cool.
It is cool.
So talk to us a little bit. I know that, there's a growing population out there, a growing demographic, where grandparents are also taking care of their grandchildren.
Yes, and that has been increasing over the past several decades. It's due to a lot of factors. A lot has to do with economic factors. If parents have lost their jobs, they're flocking back home to their parents, and they're working and trying to save money, so the grandparents are helping with the kids. Other times it's just unfortunate situations if children are in an abusive home, or if the parents were drug abusers or had terminal infections like HIV or hepatitis C and are just unable to take care of their children. And grandparents have stepped in, and the last numbers that we have from 2014 are that 7.8 million children are now living in homes not with their parents. 5.8 million are with their grandparents.
Oh my
and
goodness.
the other 2 million are living with other adult relatives, aunts, uncles, older brothers and sisters.
Oh my goodness.
Since grandparents are living longer now, they are more physically fit and able to take care of kids, and a lot of them really enjoy it. It's a lot of work, but a lot of them just reading their stories online, and even grandparents in my practice, they say they wouldn't trade it for the world. But it's really become the latest trend with children now, that the grandparents really have to step in to help take care of the grandkids.
Wow. And that's really such a difference, because I remember, as I was growing up, the one thing about grandparents that they absolutely loved is that they could take the child back home. Here, you take
Exactly.
your kid. I'll play with them for 3 or 4 hours, and now you take them back. But unfortunately, in this growing trend, they don't necessarily have that option any longer. give the child back to their kids.
No, they don't. I mean, I have several patients in my practice where grandparents had to go rescue them from foster care because the parent was a drug abuser or was dealing with alcoholism or abusing prescription drugs, and the grandparents had to go in and basically save their grandchildren, and they're raising them now and doing such a wonderful, wonderful job. But it's tough, on 50 and 60-year-olds when they thought they were done raising their kids, and now they've had to step in and start all over again. Yeah. But that's the way it is, and the kids are just so appreciative. They love their grandparents and see that their grandparents will do anything for them.
That's wonderful. What are some of the situations that the grandparents deal with then with the grandkids? When they've got custody and everything and you end up seeing them, what are some of the things that they're dealing with?
Well, basically all the same situations that parents are dealing with: school, illnesses, sports. So grandparents are pretty much doing the full role of what a parent would do in helping the child grow and develop normally. So they really have stepped up to the plate. And luckily, most of these grandparents are retired, so they have the time and the opportunity to help raise their grandkids.
That's a wonderful thing. But there's also the other side where they're on fixed incomes, and then they have to raise their grandkids, and that can be really difficult.
You're right. It can be. But over the past few years, a lot of states have come to recognize that these grandparents need financial assistance to help raise their grandchildren, and centers are being set up in different cities throughout the country where grandparents can go to these centers and apply for financial assistance. And there's a lot of great websites right now: grandparents.com, American Grandparents Association. The AARP has a webpage. It's called it's not Grandkids, I don't remember, but it has to do with grandchildren. And when you click on the AARP, it actually has all 50 states, so you can click on your state and see all of the services that are available for grandparents to help their grandchildren.
That is absolute wonderful information. Thank you very much.
You're welcome. It's really great that our government has stepped in and recognized this need and is providing financial assistance for the grandparents.
That is wonderful. Yes. Now, you are also out lecturing, from what I understand, because April happens to be Autism Month.
Yes.
Awareness for autism. And, I also know that there's a lot of times where the grandparents have to deal with a disability of their grandchild. And not only that, the parents end up having to deal with that disability as well. So give us a little insight on the Alzheimer's. On the autism. Excuse me.
So, autism has definitely been on the rise in this country over the past several decades, and right now the numbers seem to have stabilized since 2010. Right now, we are saying 1 in 68 children are diagnosed with autism, and in 2012, that's the last year we have numbers from the CDC. The numbers stayed the same, but as early as 1990, it was 1 in 150 children. So the numbers have gone up. But recently, from 2014, there was a government survey that was sent out to parents across the country, and parents reported a 1 in 45 chance of being diagnosed with autism. So there's a little bit of a disconnect right now.
Absolutely.
From what the parents are saying. And the CDC has satellite clinics set up throughout the country that do these surveys to get the numbers that they are getting. So right now they're setting up more surveillance to see how we can bridge that gap, or how we can explain what the parents are saying, 1 in 45, and what the CDC is getting, hopefully from objective measurements of 1 in 68. So they are working on that right now to see if they can bridge that gap.
That's wonderful. Because that's a pretty huge gap.
It is 1 in 45 to 1 in 68. It is, but the numbers have risen. We have gotten better at diagnosing autism. That's probably one of the main reasons, and it is such a wide spectrum that goes from mild to moderate to severe.
Yes.
Some of these kids are completely high functioning, and they just have a little social ineptness and social disability. Those are the Asperger's kids. They excel at school, but they don't really like to get involved with other students. They don't initiate conversations. They don't really have friends. They keep to themselves. So, but it encompasses this whole spectrum. So I think we've included more and we're better at diagnosing. But because of our environment and all the risk factors out there, there are definitely a lot of environmental risk factors that also are increasing autism rates too.
Wow. Wow. So, I just want to take a moment and say thank you so much, All County Healthcare, for really sponsoring this show so that we can bring this type of education and insight to the parents, to the grandparents, so that they know that there's opportunities out there, websites out there, pediatricians out there that are experts in their field that can help. So if you have any questions at all for Dr. Ocampo, please give us a call at 888-565-1470. And we're on air. She would love to answer any kind of questions that you might have about autism, and also some of the websites for the grandparents that are now taking care of the grandkids. And the other thing too is that a lot of times if you're dealing with a child that's disabled in some manner or form and you cannot take care of it, there's various healthcare agencies out there that can provide that kind of assistance for you. A CNA, somebody to come in and either babysit or help with a child that's disabled. So,
we have some of those services right now in Palm Beach County. They're
do
great.
you?
Yes.
Excellent, excellent. So, give us a little bit more insight also into some of the things that you see that you come across in diagnosing some difficulties that you have seen a trend in.
Outside of autism?
Yes.
Oh, well, I mean, basically, most of our sick visits are going to be the child that has the cough, the cold, the runny nose, a fever, the abdominal pain and vomiting. We are seeing probably more asthma. Asthma's on the rise, and more allergies and more food allergies. So that's been a big trend that we've been seeing over the past few years. More kids with food allergies carrying EpiPens. So
wow. Well, and the EpiPen, that was a really hot subject as well.
Yes, it was.
Is it still?
It still is, unfortunately. But there is a generic version available right now, which is supposedly more affordable, but again, it depends on your insurance company. But if you're a cash-paying patient, it can still be a little prohibitively expensive.
Oh, goodness.
Yes.
And here, that's a life or death situation for the children.
And, my son has food anaphylaxis, and he carries an EpiPen, and he has always been really good about it. And he's 20, but he knows it's a lifesaver. And he had to use it once a few months ago. First time ever since he had his first anaphylactic reaction when he was 2 years old, and but he had it. It saved him. He went to the emergency room in Chicago, and they monitored him overnight. It was a mistake on his part. He picked up the wrong package. What he thought was something with peanuts, which he can have, was actually cashews, which he can't have.
Wow.
And peanuts and tree nuts are different, so it actually saved his life, and he had to use it at school. And of course, I was the nervous mother, but we are seeing it a lot, and it's really hard to tell a parent your child needs this when it costs $500. But the company is trying to work with parents now to help them.
Oh, well, thank God.
Yes.
Thank God. So what other things do you do? How do you treat the asthma? How do you treat the allergies?
Well, basically, if a child comes in and looks like they're having allergy symptoms, before we send them to the allergist where they get 40, 50 skin pricks up and down their back, that's the classic traditional way of doing it, and that's still a very good way. But there is a screening test that you can go to a lab and get your blood drawn and test antibodies against environmental allergens as well as food allergens. So, and the environmental allergens are by region. So South Florida, we are a different region from, say, the Midwest, because we have different trees and grasses and pollens and weeds here. So it's all based on the area that you live. And that's a nice screening test, and sometimes you can see what they're allergic to. And sometimes if everything comes back zero, but they still have allergy symptoms, we still always send them to the allergist to get more skin testing done to see if maybe the blood test was not the best test for the child. So we have ways to check that right now. Asthma, a lot more kids seem to have asthma these days, chronic coughs, and sometimes it's hard to distinguish. And We have to really get a good history and keep track of all the different coughing episodes and see if it's coughing due to bronchospasm, asthma, or something else going on. But that's another trend that we're seeing.
Really? And what do you believe the cause of that is?
Probably environmental factors. Allergies have gone up in this country. We have tried to limit exposure in babies to allergens, and now we've done a complete 180-degree turn and say, no, we should introduce babies younger to allergens like peanuts and tree nuts and fish, so that they don't get sensitized when they're older and they can build up a tolerance when they're younger.
I remember when I was growing up, I ended up with a peanut butter allergy as well, but I loved it. I absolutely loved it. So I would eat a little bit, and before you know it, it was gone.
You desensitized yourself.
Yes. And then I was fine. No problems whatsoever. So but some of the kids, they just don't have. They haven't built the antibodies for it. Correct?
Well, the thing is, you have high levels of allergy antibodies if you're allergic to something, but you can, if you desensitize yourself by doing tiny amounts or going for allergy shots, you can actually lower those antibody levels and desensitize yourself to the point that the pollens won't bother you anymore. They are doing studies up at Duke for peanut allergy where they're giving tiny amounts of peanut powder, and kids are getting desensitized and then able to eat peanut butter.
Oh my goodness, that's amazing.
Yes.
That is really amazing.
Yes.
I love that. Now, the other thing I've also heard is that, animals are wonderful to have with children.
Yes.
Because that also helps build the immunity then to a lot of the allergies, the dander, et cetera.
So babies should be exposed to animals when they're younger. We found through studies that children who grew up on farms had fewer allergies to animals than when kids were exposed to animals when they were older. So if you have a dog or a cat and you're expecting a baby, keep the dog or cat. It's better.
Yes, absolutely. I know. And don't separate them either,
Right.
Because some parents are afraid that, like, a cat is going to go in there and smother the baby.
That, and
I think that's a myth, isn't it?
Yes, it's probably more of an old wives' tale.
Yeah.
And but if you're worried, keep the cat out. If the cat is going to jump in the crib, then keep the cat out of the room. Put a gate or something so the cat can't get in.
Yes, yes. Excellent information. I'm thrilled. How do they get a hold of you?
Basically, they can call my office. I have a website. They can go on ZocDoc. There's all different types of ways.
Give us your address and your telephone number.
I'm located in West Boca on the West Boca Medical Center Hospital campus, and my address is 9980 Central Park Boulevard. I'm on the first floor in Suite 108, and we have
telephone number
561-487-5437, and it's actually an acronym, so to speak. It's KIDS, ITSKIDS.
I like it.
That's the phone number. It's KIDS. And then we have a website, Norina, Ocampo, .com, to go on and schedule appointments or...
Oh,
yes.
great.
So
she's high tech too.
yes. Well, I'm not tinnitus, but I'm learning.
You're doing great. Now, do you accept most insurance plans?
Pretty much everything, from private insurance to Medicaid and self-pay. Yes, we accept just about everything.
Oh, that's excellent. And Medicaid as well?
Yes.
Wow, that's really impressive. And what hospitals do you work out of?
Just West Boca Medical Center.
Okay.
I'm solo, so it's really hard. I used to be on staff at the other hospital in East Boca, but I was spreading myself too thin, and it was just better for me to stay in the vicinity of West Boca because that's where my office is.
I understand. So what are some of the questions that parents should ask when they first come in to see you?
As far as meeting a pediatrician for the first time?
Absolutely.
Well, basically, parents really need to customize it for themselves. I mean, if you're a teacher and you work 9 to 5 every day and you can't take off, you probably need a practice that has evening or weekend hours, because if you have a baby, you're in the office a lot the first year of life, at right after birth, at 2 weeks to a month, and then at 2, 4, and 6 months, 9, 12, 15, 18 months. So, and that would probably not go well with the school if you have to miss all these days to bring your child in for a well checkup. So they really need to see what works best for them. You know, me being solo, I take my own call. I've done it for 22 years. I know my patients when they call me. I know exactly who they are, and if they were in the office, I know what was going on. But when you go to a bigger practice, you have the advantages of having the evening and the night and the weekend hours, which I obviously can't do. So they really have to see what works best for them, and as far as office hours and scheduling and appointments, and talk to the physician or the office staff to see what would work best for them.
So just in case, and this is for my listening audience, just in case you happen to miss her telephone number, you can always call Maddie at All County Healthcare at 888-717-7170, or you can also give her a call at
561-487-5437. It's kids.
It's kids. I love that.
KIDS.
I love that. Well, I can't thank you enough for being on our show today, you and your doctor, and it's been a pleasure. And again, if there's any questions that you might have for Dr. Ocampo, please give her a call, give Maddie a call at All County Healthcare, and we would love to put the two of you, anybody, in contact with her, any questions you might have. So I want to thank you again for being part of the show.
Oh, thank you.
And and we're going to do a commercial right now, and we will be right back. So don't go away. We have another amazing guest. Thank you so much. Don't go away.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. I'm Norina Anderson, your life and energy coach, and this is You and Your Doctor, where we teach you how to live a longer and healthier life. We're being presented by AMP2 TV, and we're also streaming live on AMP2 TV. And we're being proudly sponsored by All County Healthcare, where patients are the heart of their business. We're also streaming live on All County Healthcare Facebook fan page, so you can join us there as well. And just in case you can't stay for the entire show, we are going to be airing this show again on 95.3 FM on Tuesday at 11 a.m. and 3 p.m. in the afternoon. And if there's any questions whatsoever, please please call 888-717-7170. Ask for Maddie, and she would love to put you in contact with any of the doctors that we might have as guests. So, thank you for joining us again. And we have another very fascinating guest. Welcome, Mr. Dr. Sanon. Excuse me.
Thank you, Norina.
Welcome. It's great to have you.
Pleasure to be here.
My pleasure. So talk to us. Where did you first study? How long have you been here in Florida? And some of your background information?
Sure. So I'm originally from India. I went to med school in India, and after completing that, I came to the U.S. back in 2005. And I've been very fortunate to have trained at some of the most prestigious cardiac centers in the country. I was in Houston in the Texas Medical Center initially, and then moved to Mayo Clinic in Rochester.
Where fabulous.
I had the good fortune of really training in some of the most advanced cardiac procedures under some of the leaders in the field there.
Wow.
So prior to my coming down here to South Florida, I was in practice in the Destin area.
Okay.
Where I launched some very innovative structural heart disease programs that were not available in that community. And subsequently, I had decided to move down here and join the Tenet family. So very excited to be here.
That sounds wonderful. So you better give us your specialty then. Give us an insight, because you said something really powerful, that you were in Destin and that you had created some very high-tech, state-of-the-art applications for
structural heart disease.
So
I'm an interventional cardiologist by training.
Okay.
And over the last few years, there has been a development of a new subfield of interventional cardiology called structural heart disease. Very innovative field, very dynamic and rapidly evolving field.
Describe that just a little bit for us before we go on, so that our listeners can understand that a little bit more.
Sure. So structural heart disease essentially involves diseases which can affect the cardiac valves. There are four major valves in the heart.
Okay.
The walls of the heart, between the chambers or around the chambers, or the chambers itself. In some cases, the heart dilates, the chambers become larger. Pressures in the chambers can increase. So all of those sort of diseases fall under the category of structural heart disease. The field that I specialize in essentially deals with minimally invasive cardiac surgery. And so back in the day, when people had valvular heart disease or holes in the heart, you had to go to a cardiac surgeon and undergo open heart surgery.
Right.
But now with the advent of structural heart disease, you can now get some of the same therapies and get the treatment for these valvular problems or defects in the heart based on catheter therapy, which can be delivered via veins or arteries in the groin or sometimes in the wrist.
Well, that's very, very interesting. My youngest daughter, when she was born, she had a heart murmur, and she also had pulmonary stenosis. And they decided just to keep an eye on it, just to watch it and see what would happen, whether or not it would close up immediately. And she was born at like 4.5 pounds. So to hear this new innovation then, where they don't necessarily have to do the open heart surgery. So do they do that through like a regular catheter?
Yes.
Okay.
So this is all technology, devices, plugs, which can be delivered using specialized catheters. And these are introduced into the heart using veins in the leg. And in rare cases, you can introduce them using an artery in the wrist. But essentially, it's all transcatheter therapy.
Wow, that's very, very interesting. Yeah, and she ended up having to have a catheter put in there so that they could go in and really put the dyes in and notice
measure
where all
pressures.
the yes, and I remember.
So it's a very new and innovative field. It is a field where we use a team approach.
Okay.
Structural interventional cardiologists like myself team up with cardiac surgeons, and then we pair up and actually put our heads together to decide how to do this in the least invasive fashion for our patients.
Wow, interesting. That's very good. But there you go. We just gotta get you a little closer there.
Sure.
So you go in, and is it just through the groin area, or is there any other means of entry that you use?
It's either an artery or the vein in the groin in most cases. Now, depending on why we are doing the procedure and what is the problem with the heart that we are trying to fix, the devices will differ. For example, you can use this therapy to treat a leaky mitral valve. There are 4 valves in the heart. One of the valves is called the mitral valve.
Okay.
And in a normal heart, the valve opens and closes like it should without any leakage. If the valve is defective, there's leakage of blood. Earlier, in earlier days, the only treatment for this was to perform surgery. Now, for patients who are high risk for surgery, you can, as a heart team, determine how high the risk is, and then you can actually offer something called a mitra clip procedure.
A micro clip?
A mitra clip.
A mitra clip, okay.
And this device looks like a little clip, and it is introduced through the femoral vein.
Okay.
It's a vein in the groin.
In the groin, yes.
And it can be used to deliver that to the mitral valve and then clip the leaky valve. So that's an option.
Wow.
Patients who have narrowed mitral valves or narrowed aortic valves can now get similar delivery of devices through arteries or veins, and those tightened valves can be opened up using balloons. Or you can deliver a brand new valve through the femoral artery and reimplant it across the old valve of the patient.
You're kidding.
So
oh my gosh.
A lot of exciting new technology.
That is. Now, were you personally part of that team that developed this?
I was not. It was developed a little before my time.
Okay.
But I was one of the first wave of new physicians that were formally trained in these techniques.
Oh, okay.
And just from being at Mayo Clinic, some of my mentors were people who invented these devices. And so we had access in research form to a lot of these devices before they were commercially available.
That is impressive.
So,
that is wonderful.
So a lot of new exciting technology, and one of the new devices which I wanted to share with you and your audience is called the Watchman device. And this is a small device. It looks like an umbrella. It is inserted from a vein in the groin, and it can be used for patients who have atrial fibrillation. So irregular heart rhythm, which a lot of our patients do. And the problem with atrial fibrillation is you need to be on blood thinners. To prevent a risk of stroke. And while it prevents a stroke, being on blood thinners is not fun. That's one.
I know. And not only that, you get the marks and everything.
You get the marks, right?
Yes.
But you're also at risk of bleeding.
Yes.
So if you're an active person and you're on blood thinners, there's always that risk that you may fall and have a major bleed.
Yes.
Or
just a bruise, too.
Or a major bruise, right? Or you may have had bleeding in the past, in which case it becomes difficult to keep a person on blood thinning. So for such patients, we can offer the Watchman procedure, and this device is implanted in the heart. It prevents the blood clots from exiting the heart and causing a stroke. So now these patients can be taken off of blood thinners, and while they're still protected against the risk of a stroke. So it's a very innovative procedure, and we are introducing this at our site at Palm Beach Gardens. Very soon.
Oh my goodness. And you're like one of the only ones here in Florida?
There are a few other sites in Florida. Delray Medical Center is one.
Okay.
So we can offer our patients these procedures at Delray Medical Center or soon at Palm Beach Gardens.
Excellent.
But it's a very exciting new procedure.
It is exciting because usually, they don't have any other option other than open heart surgery. And one of my girlfriends, her father, he's back in Illinois, but he ended up having a very difficult time and had open heart surgery on a valve, and it didn't work. And it's unfortunate because now he feels as if there's no place that he can go to. There's no way to turn. He's becoming more weak. He's on blood thinners, and his color is pale. His lips are purple.
So the other advantage of, not advantage, but way structural heart disease can help patients is exactly the kind of patient you're describing. Somebody who had open heart surgery and was given a valve, and if that valve has stopped working optimally, there are options now. We could go in from the groin and implant a new valve within that old valve, saving that patient another open heart surgery and fixing the problem. In addition, one of the procedures that I have expertise in is peri-leak closure. Okay, fancy word, but what really means is if you have a valve, surgical or otherwise, sometimes patients' tissues around that valve starts degenerating. So as the tissue breakdown occurs, you can have leaks that develop around a surgical valve.
Oh, okay.
I can now go in either from the groin, in some cases from the wrist, and put a little plug in that leaking tissue and seal it, kind of like you patch a tire.
Oh my goodness.
And so that saves the patient repeat cardiac surgery and takes care of the symptoms.
And that's stationary, that stays in there, it's not going to move?
It stays in there, it becomes part of the patient's body. And over time, the patient's body lays a layer of cells over it and covers it, just like skin covers a bruised area on the skin. And it becomes internalized.
Wow, that is really exciting.
So a number of different options are available to our patients now.
So how do they get a hold of you? That's very important.
So I can be reached. My office number is 561-425-9881.
And where are you located?
And my office is based at Palm Beach Gardens at the hospital site.
Okay, at the hospital.
Yeah.
And do you work out of any other hospital, or is that just...
Also at Delray Medical Center.
Oh, okay.
Yeah.
Great. So in case you happen to have any questions whatsoever for Dr. Sanon, please give us a call here, 888-565-1470. This is some really, really exciting news. And I just want to take the opportunity again to thank All County Healthcare for bringing these professionals, for sponsoring this show so that we can bring these professionals to you. So you can hear some of the most amazing state-of-the-art technology that is happening for healthcare, and especially for the cardiac healthcare right now. That's just absolutely amazing, because a lot of our patients, a lot of our demographics here, our audience are 65 and over. So a lot of them are dealing with either stroke or heart attack, or they've had open heart surgery already, and a lot of our patients, our listeners also end up being in their middle 70s, late 80s, and they need some sort of help. And sometimes it's really difficult. Also, I don't mean to interrupt you, but sometimes it's really difficult to have those individuals back in the hospital.
Absolutely.
Because they could not withstand another surgery.
So there's a number of advantages besides the obvious that this is minimally invasive.
Yes.
Short hospital stays.
Really?
You can just imagine comparing the hospital stay of an open heart procedure versus a hospital stay of a procedure in which there's a 1 centimeter nick in the groin. Most of the patients that get these new procedures can go home within the next day or two.
Oh my goodness.
They can be active. Some of these procedures now we can perform with very little sedation, especially the aortic valve replacements. And,
that is incredible.
So it's a procedure which is tolerated very well by patients, especially older patients.
Wow. Well, that's so exciting, because a lot of times they didn't think that they had any options, and especially down here in Florida, because we're really active. We have a very active lifestyle. And for somebody, in their mid-70s that are playing tennis or playing golf, and then all of a sudden, have a heart condition and they're really stopped in their tracks. So this is great information. I'm so excited.
I'm glad to be here today.
My goodness, we're thrilled to have you. Are you kidding? And I can't wait to give my this information to my girlfriend to filter it down to her father and see, if anything can happen. But at least now we know that there is another option and something that's viable.
Absolutely. And we have a really experienced team of physicians here.
Do you?
We work as a team. We have cardiac surgeons, structural cardiologists, good anesthesiologists, and we all work together towards these therapies for our patients.
That is absolutely wonderful. I love it. So talk to us also about the aortic valve replacement. That was something that, what is that called? A
TAVR. TAVR.
TAVR, okay.
And so what that stands for is transcatheter aortic valve replacement.
Okay, and that's what we were talking about, how you can go in through the groin and go up into there. And
so the aortic valve is one of the 4 valves of the heart. Some consider it to be one of the main or most important valves of the heart. And what happens over time is the valve becomes calcified and it becomes narrowed. It can in many cases. And when it does that, then there are really two options when the narrowing is severe. One is to go in for open heart surgery, which is still a good option for patients who are younger and low in risk. But for patients who have moderate risk or high risk, TAVR becomes a very viable option. And this is a procedure that we do in the hybrid cath lab. In some cases, we can do this with minimal sedation, just like a heart cath.
Oh my goodness.
So we call it MAC anesthesia. And the TAVR in that case is called minimalist TAVR. As the name suggests, it's very minimalistic in nature. These patients have been shown to tolerate the procedure even better than TAVR with general anesthesia.
Really?
These patients can be discharged home in the next day or two after the procedure.
Oh my goodness.
So it's got a very low, small footprint for the patient.
That is incredible.
And the patient goes home with a brand new valve.
That is incredible. And, you know, as I mentioned before, my daughter, my little one, she had the hole in the heart, the heart murmur. What are you doing in order to be able to help those individuals?
So pediatric patients are slightly different, and I'm an adult cardiologist, so that's not usually the patient population I deal with. But there are about 20 to 25% adults who have something called a PFO or an ASD.
Okay.
Essentially, it's a little hole between the two upper chambers of the heart.
Okay.
Now, just because someone has a hole in that position in the heart does not mean he or she needs closure of that hole. But if a person has that hole in the heart and has had a couple of strokes, well, then that hole could be responsible for the strokes in that person. You need a full workup. We need to look at everything. And in many cases, those patients are good candidates for closure of that hole.
Okay.
And that is a procedure that is done, again, in the cath lab with very little sedation through the groin.
Amazing.
And we can put a plug in that hole. The plug has two discs, one on either side of the hole, and it basically cinches and tamps down the hole just like a patch would.
Really?
And those patients can go home the same day or the next morning. It's a very useful procedure for these patients.
That is really amazing. I'm like shocked. I love where we're going with our innovation and what they have been able to create.
Yes.
You know, because a lot of times down here, you know, a stroke is a big one. My mother had a stroke probably about a year ago, I think it is now. So and then she's on blood thinners. And how difficult it's been for her to rehab. So, what's the normal range of patients that you see?
Age-wise? So age is no longer...
Since you said that you don't necessarily deal with the pediatricians, but the age range.
So the typical age range that I see in office is elderly.
Okay.
And elderly used to mean different 5 years ago to me than it does now. Because
you're older now?
No, that too, a lot of gray showing now. But, you know, if I have a patient in my office that is 75, 80, we often joke about it with my staff, we have a young patient today. Because we are seeing patients that are older than ever before. The oldest patient I replaced a mitral aortic valve on is now 97.
Oh my gosh.
And so a lot of patients in their 90s, obviously a lot of 80s and 70s too, but more and more trend towards seeing older people. And the reason we're seeing that is because now these technologies can be used to help these patients in a safe manner, in a lower risk manner than open heart surgery. And so all of these options are now on the table for these older people, whereas even a few short years ago, there was no option for them.
Wow.
So it's a very...
You're right. They just sat there. And they couldn't move. They were afraid to move, as a matter of fact, because a lot of them were on the blood thinners, and they knew all they had to do was bang themselves or fall. And especially when you get to that older age, they end up, you know, falling is a big deal.
Now, coming back to the blood thinners, which is an issue with atrial fibrillation, interestingly, a lot of younger patients also have atrial fibrillation.
Really?
It can occur in all age ranges, usually with older people, but there's younger people too. And you can imagine a younger person who needs to take a blood thinner, that's a major lifestyle
That
problem.
is.
You might want to go skiing, you might be into road biking, running, and
Yeah.
if you're on a blood thinner, there's a great risk that you may fall and have a major bleed.
Wow.
And so the Watchman device then becomes a very reasonable option to discuss for patients, irrespective of their age. But a patient who has atrial fibrillation is on a blood thinner and is at risk of bleeding or has had bleeds in the past.
So, audience, if you have any questions whatsoever, or if you're dealing with that, and especially at a younger age, please give Dr. Sanon a call. Let him know, and you can ask him any kind of questions. What's your telephone number, so in case somebody needs to ask you a question?
So it's 561-425-9881.
Okay, great. And
the
you're
staff,
located?
and
Yeah.
I'm located at Palm Beach Gardens Medical Center.
Okay.
And the staff is very nice. They're always happy to take your calls and help you out with questions and guide you in the right direction.
Yes. So even if you can't get to Dr. Sanon, you can always call the staff there and then ask the questions, and they might be able to help you in some manner or the other. And this is just really exciting news. I'm ecstatic. Well, because I deal with a lot of various doctors, but I'm also understand a lot of my friends and especially down here in the lifestyle that we
Right.
have. So now you're making the new 80s, the 60s? The people that
Pretty
are in their
much.
80s now are the new 60s, right?
Yeah.
Excellent.
No, it's a very exciting field, but more than that, it's a very satisfying field to be in.
Oh, I bet it is.
You get to help people. A lot of my patients, when they come to me, are so short of breath, which is a common symptom of these problems. They can barely walk from their bedroom to the bathroom.
Wow.
And they get a procedure. They go home in a few days, come back a week later to check with me. And, it's the best feeling when you see them walk in their golf gear, which they have not worn in many years. Or when they come back and they tell you, we played with our grandchildren for the first time in 5 years. So it's a very satisfying field to be in. I'm very fortunate to be in this field.
Yes. So, you said something really important. You said, a loss of breath. What else does somebody need to identify to see whether or not they need to come into the doctor? What are some of the other symptoms?
So the symptoms depend on the type of problem the patient has. In general, if you have a leaky valve or if you have a narrowed valve of some type, the common problem that you might have is shortness of breath.
Okay.
And this could be minimal shortness of breath, and over time it progresses to the point where you cannot even do your activities of daily living. So that's one of the common symptoms. This leads to heart failure, which then can cause swelling in the ankles and legs. It can cause shortness of breath when you try to lay flat in bed. Those are the common symptoms of heart failure and most of the valve problems. Now, if you have something like atrial fibrillation, that may present with a feeling of palpitations or irregular heart beating. And it's important then to check with your cardiologist so that they could figure out what's going on. But in general, valve problems might present with shortness of breath as the first presenting symptom.
Wow, that's now. Does insurance cover this?
Yes, all of these procedures are commercially available, and insurances will cover them. There's a lot of testing that we do before we offer the procedure to make sure that the patient is a good candidate for the procedure and to make sure the patient will actually benefit from the procedure. And in most cases, for the patients we determine are good candidates, insurance will cover these procedures without any problems.
That's so important too.
And our staff is always there to help the patient navigate some of these issues if there ever is one.
Oh, that is excellent. Excellent, yes, because sometimes the insurance complications can be quite overwhelming, and especially, depending on what age you are.
Right. And, sometimes it takes a call from the physician's office to explain why a patient requires a certain procedure. And so we always want to be there to help our patients with that sort of thing. Because, if you think about it, if you're not feeling well, the last thing you want to deal with is
It's a bunch of
insurance.
paperwork.
Exactly.
Yeah, absolutely.
Your
All
fo-
these
you-
questions.
Your
yeah.
focus should be on feeling better and getting the therapy that you need not some of these other things. So,
Yes.
so our staff is trained to help patients with all
That
of
is
that.
absolutely wonderful. I can't thank you enough for being here, Dr. Sanon.
Thank you.
It is a pleasure, and thank you for this information and knowledge. And if you have any questions whatsoever, please call All County Healthcare at 888-717-7170. Ask for Maddie, and she can put you in contact with Dr. Sanon. And, this is just absolutely wonderful stuff. Listen, we'll see you next week, Tuesday, between 6 and 7 again. It's a pleasure having you on the show, listening to us, and we're going to have some more exciting guests. So stay tuned. Come back. See us next Tuesday. It's been a pleasure being with you this evening. Have a good night.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those